afternoon, Ian.
Good afternoon.
My name is Susan. I'm a student nurse practitioner from Louisville University, and I will be taking care of you today. What brought you in today?
I'm here for my physical.
Oh, you're here for your physical. Okay, I will be assessing and listening to your heart and your lungs, okay? And I'm gonna wash my hands. I will first start by just looking at you just to make sure that you're breathing okay. Do you have any issues? Have you been coughing of late? Have you been having any shortness of breath? No, okay, that's good. If you could take out your shirt for me, please. I will take this for you. Like I said, I'm just gonna look to make sure that you're breathing okay. I don't see any labored breathing. I don't see any use of accessory muscles. The color of your chest is okay in the anterior and the posterior. I'm also looking at that. And you're breathing okay. The only thing I see on your chest is a tattoo on the lateral side of your chest. I'm going to be putting my hands on you. I hope my hands are not cold. And right now I'm palpating to see if I can see or hear any crepitus, which I do not see. I do not see or hear on the anterior, and I'll do the same to the posterior too. And I don't appreciate any crepitus on either the anterior or the posterior. That means that you don't have any atelectasis. The next thing I'll do, I'll still put my hands on you again, and this time I will be looking for tactile parameters. And what I'm gonna be doing is when I put my hands on you, I want you to say 99, okay? Okay.
99, 99, 99.
And I will do the same for the back. Say 99.
99, 99, 99, 99.
I hear very good resonance, so he has no problem. I don't hear any abnormalities. The next thing I will do is that I'm going to use my stethoscope and I'm going to listen to your lung sounds now. If you can just breathe normally for me. But I hear good breaths. I don't hear any straining. Your breath sounds are clear. I will do the same for your back. And I'm starting up here through from C7 all the way to T1. If you can take some deep breaths for me. Back again. Again. Take some deep breaths for me. Again. Again. If you can raise up your arms for me, because I'm going to listen to your sides, and take some deep breaths for me. Good. Good. Other side. Good. I would say that his posterior lung sounds are vesicular. I don't hear any abnormalities. The next thing I will do is that I'm going to, I'm also going to make sure that I'm looking at your trachea to make sure it is not deviated. I don't appreciate any deviation. It is in the right place. The next thing I'm going to do is that I'm going to percuss for the your lung borders, and I will make sure that I'm avoiding any lips, and so hearing is good resonance, so that is good. The next thing, I'm still going to do the same thing. I'm going to percuss, and this time I will be looking for the diaphragmatic excursion. That means how that I'll be looking for how the diaphragm moves when you inspire and expire, during inspiration and expiration. And I'm going to put some marks and then mark that. Okay. I'm percussing to make sure that I have I hear some dullness, and I'll do the same. And then I'll move from up. Same. Okay. Oh, can you breathe? Can you breathe in and hold it? Okay. I'm gonna do that for the other one. I'm going to measure that distance. Okay. Now I'm measuring this distance, and it should be anywhere between 3 and 6, and I think yours is about 5, I think 5 centimeters, which is normal. I'm going to take this out. Can you turn for me? Turn this way. The next thing I'll be doing is I'm going to be looking for the thoracic expansion, and it should be symmetrical. And I'm going to put my hands on his 10th thoracic rib, and then I'm gonna put my thumbs there. Can you breathe in for me? Okay, breathe out. Breathe in again. Breathe out. Good. And they are moving in a symmetrical way, so that's a good sign. The next thing I will do, I want to listen for the vocal sounds, and what I'm going to do is that I want you to say, when my stethoscope touches your skin, could you please say 99 for me?
99, 99,
Good.
99,
Good.
99, 99,
Mm-hmm.
99,
And I'm going to do the same for the back.
99,
Mm-hmm.
99,
Mm-hmm.
99,
Mm-hmm.
99,
Mm-hmm.
99,
Mm-hmm.
99,
Mm-hmm.
99.
Good. That is the end of your respiratory assessment, and I would say it is a normal respiratory assessment. I don't see anything wrong with you. The next thing I'm going to do now is assess your heart, and I'm also going to be listening to your heart sounds too. The next thing I'm going to be doing is assessing your heart, and of course I'm inspecting. I already inspected you, so I don't want to, I'm not going to do that. Have you been having any issues, any cardiac issues like chest pains or palpitations? Like your heart beats fast? No? So you have not been having issues. So I'm going to be assessing your heart, and I'm also going to be listening to your heart sounds too. Okay? Okay. Now, if you could lay down for me. The nurse had checked your blood pressure, and your blood pressure is good. It's 120/80, and your heart rate is 60. That is very normal. And I'm just checking to make sure that you have no pacemakers. I don't see any issues with your breathing. You're breathing okay. I mean, your heart is beating okay. I don't see any struggles with that. If you turn to your left, I want to look at your, no, just your neck, yeah, that way. Now I'm looking for the JVP here, and I do see the pulsation there, and the normal should be between 2 and your jugular JVP should be less than 4 centimeters, and I see some good pulsation there. The next thing I will be doing now, you can look forward now. The next thing I'll be doing now is listening to. Before I do that, I need to look. I don't see any heaves or lifts or any thrills. So that's a good sign. The next thing I'll be doing now is listening to your heart sounds. I'm listening to your aortic valve, which is on the second intercostal space, sorry, and I'm listening for your aortic valve. Then I'll go to the left side on the second intercostal space, and I'm listening to your pulmonic valve. Then I'll go to the second and third and fourth and fifth intercostal space. I'm listening to your tricuspid, and then I'll go laterally to listen to the apex of the heart and the mitral valve. And okay, and then I'll go to the fifth intercostal muscle, mid-clavicular line, and I'll be listening to your mitral valve and the apex of the heart. I don't hear any. I only had S1 and S2. I did not hear any abnormal sounds. So your heart is okay. The next thing I want you to do for me, if you could lay on your back and turn to your left for me. Like on the side, lay on your left side. And what I'm doing now is that I'm going to the fifth intercostal space, where the heart of the apex of the heart is, and what I'm trying to listen to now is for any mitral stenosis or any mitral regurgitation, and that's what I'm doing. I don't hear anything. Thank you. If you could sit up for me. And kind of lean forward for me, and I will go to the second intercostal space where the aortic valve is, and what I'm trying to listen to now is for any aortic stenosis, and I don't hear any murmurs or anything on that. The next thing I'm gonna do, I'm gonna listen to your suprasternal notch. Sometimes murmurs radiate there, and I don't seem to hear anything. And I'm also going to go like to your axillary too, and checking for any radiation of murmurs, and I don't hear anything. I'm going to do your peripheral vascular system now, but before I do that, I want to listen to your carotid, which I'm gonna kind of palpate first, and then I'm gonna listen for that with my stethoscope with the diaphragm first, and then I'm gonna turn to listen with the bell to see if I can hear any bruise. And I don't hear any bruise. Then now I'm going to go to do your peripheral vascular assessment, and I'm going to listen to your radio pulses here. BQ, and then I'm going to listen to your radio pulses here, and they are good. And then I'm gonna, it's okay, you can rest, move your hands. And then I'm gonna be looking and even for the warmth, and I think you have the right temperature. And then can you put your fingers up there? And what I'm looking now is I don't see any crabbing, which crabbing would be a sign of hypoxia. Crabbing, so which means you do not have any. Crabbing could be a sign of some cardiac issues. I'm going to be pressing on your fingers, on your nails,
Okay.
to look for the capillary refill. And what I'm looking for is to make sure that you have enough blood return. You do not have any hypoxia, lack of enough oxygen in your blood. And I think your capillary refill is less than 2, which is normal. The next thing, I'm looking at the distribution of your hair, on the hair on your legs, and it seems to be good. I don't see any shiny. I don't see anything. What I'm looking for right now, I don't see any cellulitis, I don't see any varicose veins, and I don't see any edema. Now I'm gonna be listening, feeling the warmth of your legs, and they are warm enough. The next thing I'm gonna be doing is that I'm going to be listening to the palpation, to the pulses of your popliteal, and I'm gonna do this. If you can bend your knee, yes, thank you. There's some good pulses there, and I'm gonna do the same with the other one. And that's good. The next thing I am going to do, like I said, I don't see any edema. I'll be listening to your posterior tibial pulses, and they're good. And then I'm going to listen to your pedalis dorsalis pulses, and yeah, and they're good. The next thing I'm going to do, I'm going to do the same like I did with your fingers. I'm going to do that with your toenails, to make sure that we have enough distribution of oxygen. And that's what I'm doing. And your capillary refill is less than 2. And now that, thank you so much, Ian, for letting me assess you. I can tell you that your assessments were good. You had no issues. Your respiratory assessment was okay. Your breathing is okay. Your lungs seem okay. Your heart is okay too. I don't see any problems with your peripheral vascular system too. Do you have any questions you would want to ask me? No. If you can bring down your pens, and so all I can tell you is that your respiratory and your cardiac and your peripheral vascular systems are good. You have nothing to worry about. And thank you so much.
Thank you.